There is ayan. Sa mukha. Sige. Last time, class, di ba, we started our discussion with the anti-cancer, but as in very short lang. Introduction only. I think we ended here with the different general signs and symptoms of cancer. General signs and symptoms lang ha kasi depende on the type of cancer, meron pang mga additional signs and symptoms. But generally, cancer patients experience this signs and symptoms like they will have sudden weight loss, and that is unexplained because they don't really go on diet, but suddenly magda-drop ang weight nila. There will be fever, and then most of the time the fever will not be treated with paracetamol or ibuprofen. Most of the time it will subside through the use of naproxen. Itong fatigue kasi, this is very common if you have something na if you don't really feel well. So general signs and symptoms na lang yan siya. But if you have changes in your bowel habits and bladder functions, example, you always have diarrhea and suddenly you have constipation na sudden, and then changes, merong mga drastic changes talaga. It can be a sign of cancer. And then sores that do not heal. And then you have here white patches inside the mouth, or white spots sa mouth, especially for smokers, can also be a sign of cancer. And then ito for us girls, especially for us girls, unusual bleeding or discharge. So for example, it's not really your menstruation, but suddenly there is unexplained bleeding, or there are changes in the discharge. Di ba tayo girls, meron naman talaga tayong discharge. Yung tinatawag nga natin na white blood, that is actually a discharge. Pero pag nag-iba yan siya class, magiging iba yung color niya. Example, naging green, and then meron na siyang odor na as in grabe talaga. Unusual na yan siya. So that may be a sign of an underlying condition. It can actually be an STD or an STI, sexually transmitted infection, but it can also be because of cancer. And then most of the time, yung may mga makapa-kapa na mga lumps anywhere in the body. Sa ato girls, most of the time it's on the breast. So sign lang naman, pero take note that not all lumps or thickening in the body is cancerous. Some of them are benign. And then yung mga changes sa mga warts or moles in the body. So that is the reason why there are people na nagpapatanggal sila ng moles. So they have their moles removed, especially if their moles are kanang ginatawag pa nato in layman's term, buhi, kanang naga-increase good ang iyahang size. Kasi pag may mga changes, it can be cancerous. And then nagging cough or hoarseness. So we ended with our discussion here sa general signs and symptoms of cancer. Now, let's move on sa classifications of cancer. Cancer's class can be classified as either carcinoma, melanoma, lymphoma, leukemia, and sarcoma. You can see this sa mga medical charts of cancer patients kung anong klaseng cancer ang nasa kanila. When you say carcinoma, this one is more on the epithelial tissues. So again, the abnormal cells start their growth in the epithelial tissues, and most commonly, they originate syempre in the skin, the lungs, the breast, the pancreas, and other organs, and the glands. As long as the problem starts with the epithelial tissues, epithelial cells, the linings ng mga tissues natin, carcinoma ang tawag. Nila ang mga buhi ng mga moles. Okay, so this one are examples of carcinoma. We have sores here that do not really heal. And then again, most of the time, it's on the epithelial tissue, so the lining ng skin or other organs. So we have here basal cell carcinoma, and then this is another type of cell, but both of them are epithelial cells. So this one naman is a sore for squamous cell carcinoma. Yeah, murag samad lang na siya. But our problem, di ba, for the general signs and symptoms of cancer, these are sores that do not really heal. And syempre, nagadako siya. Okay? So, example of this, example sa breast cancer, kung sa epithelial cell din siya nag-start sa lining ng mga tissues for the breast, it can also be classified under the carcinoma. So this one here is, pagtanaw pa lang nimo, makaingon na jud ka nga, cancer yun na siya. Kasi we don't really normally have this kind of coloration, discoloration in the breast. Okay? Again, this one is under the carcinoma. And then when we call the cancer melanoma, the cancer starts in the pigment in the skin. So this is for the skin. Remember, we have the melanin. And if we have abnormal number of melanin in the skin, it can be cancerous. We call it melanoma. So this one is more on the moles class, na kanang buhi gani, tapos nagadako siya, kana pwede pod na siya melanoma. So this one is benign, and then this one is malignant. So naga-black na siya, and it's actually growing in size. Naga-black siya kasi, di ba, remember, melanin is a pigment, and pag daghan na kaayo na siya, mag-black, black man jud, black pigment man jud, no? Actually brown. That is why ato ang color is like most likely brown. Daghan man tag melanin, ang atong buhok pag daghan na kaig melanin, brown to blue, brown to black. Okay? So mao pud na siya ang sa skin, if daghan na kaayo og melanin, mag-black na siya, and it's growing. So this one is a type of cancer, melanoma ang tawag. And then if you hear the word lymphoma, it's a cancer originating from the lymphocytes, which are part of our immune system. And most of the time, it will be seen in the lymph nodes. So sa mga lymph nodes nato na siya mag-originate. So sa Bisaya ang lymph nodes, kanang, I forgot, kanang usahay diri pag naagog kay sa mad class, usahay makahikap kag bukol diri sa imuhang likod dalunggan. It's actually a lymph node. O kaya kung ang imuhang samad is on the lower part, usahay sa singit nimo siya magunitan, bukol, lymph node na siya. Ay, lalulusay. Thank you. O kaya sa kilikili, usahay makagunit ka o kanang murag bukol nga gamay, yalusay, tama na siya. Sa kilikili pod. So take note of the different parts of the body wherein we can see our lymph nodes. Sa neck, and then we also have here on the armpit, and even in the groin. So ito yung mga parts wherein lymphoma will be seen. Okay? Wala siya nagadako, pero wala po siya nawala. Actually, most likely kita, dili man nato na siya mahikapan if we are okay. But if we have infection or we have mga injuries or mga samad sa ato ang lawas, magdako man gud na siya, and that is a sign that our immune system is working. Okay? Pero after the infection or after mag-heal na ang mga sores, nawawala din naman yung tinatawag natin in Bisaya as lusay. Laway sa mukay. Karon ako kamaluan na. Yeah. After tetanus injection, nag-swell ang sa kilikili. Ang sa ako katong tong nagpabakuna ko sa COVID, tong sa Johnson, after injection, after a day, sakit akong ilok. Paghikapon ako kay ma-feel jud na ako ang lusay. Pero that's a sign that your immune system is working. Dili siya tinuod din. Okay. Again, lymphoma originates class in our lymphocytes of the immune system. Usually in the lymph nodes siya makikita. So just like this, sa neck nila nakikita yung mga source for their lymphoma. Now, pag narinig nyo naman ang term called sarcoma, this one naman is the cancer cells originate in soft connective or supportive tissues. Carcinoma is on the epithelial tissues, ha? When you say epithelial, in your anatomy and physiology, epithelial means the lining of an organ, lining ng mga cells sa organ, or syempre skin is also an organ. Pero pag sarcoma, it's on the connective tissues. So therefore, pag sarcoma, it is mostly seen in the bones, like the bone cancer. If we look at the name of the cancer, may sarcoma yan siya sa last. So merong specific name and then sarcoma ang last kasi nga it's on the connective or supportive tissues. And then sa muscle, sa fats, or sa cartilage, yung sa cartilage lang, uncommon lang, pero mostly we have the bones, the muscles, and the fats. So this one is an example of a sarcoma in the hand. You have the connective tissues there, and then may nag-develop na tumor. So, syempre, lalaki talaga because remember, cancers grow rapidly, they multiply rapidly. Ayan. That's sarcoma. And lastly, we have the leukemia. Leukemia naman is cancer of the blood, though it will not really give us a solid tumor, unlike the four na nauna na natin i-discuss. So, si sarcoma, carcinoma, melanoma, and then lymphoma will give us the solid tumors wherein there is really a growth of a lump na ay solid yun na makita nato, but for leukemia, wala. Okay, but it's on the blood. So what are the common signs and symptoms of leukemia? This one, itong weight loss, fever, and frequent infections are actually through general siya for cancer. There will be easy shortness of breath, ito weakness, and the pain or tenderness, kasi mga general signs and symptoms na yan siya. Meron din siyang psychological effect, fatigue and loss of appetite. And then just like the lymphoma, there will be swelling of the lymph nodes also. And since blood ito, and then this is not just about red blood cells, we also have our white blood cells. So the lymphatic system are also affected. So we have there the lymph nodes and the spleen. Kasali yan siya, and the liver, there will be enlargement. But most of the time, ang makikita natin kasi sa mga leukemia patients natin, they always have this purplish patches or spots, and easy yung pag-form ng kanilang bruise sa body. So, permi sila may pasa. Okay? But aside from that, ayan again, makikita natin sa kanila yung iba pang general signs and symptoms of cancer. So, blood yan siya, leukemia. What's wrong with that? Most of the time, it will be diagnosed with, una talagang makikita is on the result of the CBC, wherein there is an abnormal number of the white blood cells in the body. Yan yung pinakaunang makikita when we do laboratory testing sa patient. Okay? So those are the types of our cancer. Any question? Any questions sa types of cancer? Wala? So let us move on. Let's talk about cancer chemotherapy. So bakit tayo nagbibigay nito? What's the purpose? So most likely this is for the pagpatay. Let's kill the cancer cells. That's our goal for cancer chemotherapy. So these are chemical substances that have the ability to exert cytotoxic action in the cancer cells, or they can what do you call that? Pwede silang mag-cause ng apoptosis. When you say apoptosis, it's programmed cell death. Parang patay ang cell, and so that we can arrest the progression of the tumor sa patient. That's our goal for cancer chemotherapy. Now, the ultimate goal is syempre cure talaga ng cancer, long-term and disease-free survival. And then, however, pag example, hindi na talaga ma-achieve yung as in cure talaga na magiging cancer-free talaga ang patient, then the goal of chemotherapy becomes control of disease na lang para hindi mabilis yung pag-progress ng cancer, hindi mabilis yung paglaki ng solid tumors. Okay? Now, for advanced stages of cancer, kung terminal stage na talaga, like stage 4 na, then syempre, our goal will not be cure anymore or control of disease. We can no longer do that. Instead, the goal now will be palliation. Okay? Control na lang of the symptoms and that the patient will not suffer. So for example, sorry, kung naa siya'y pain, then let us control the pain. Pero we can no longer kill the cancer cells if nasa advanced stage na siya. Nagatanggal ang buhok. That's the side effect. That's always the side effect of cancer chemotherapy drugs. Because take note class, we don't have a magic bullet or a cancer drug that targets only the cancer cells. If they exert lethal cytotoxic actions to cancer cells, these chemotherapy drugs are also toxic to the healthy cells. So for example, in the scalp, our cells there are healthy, walay cancer din ha, pero if we give them cancer chemotherapy drugs, the healthy cells there will also be killed and that will lead to alopecia. So mauna nga matanggal ilang buhok. Actually, dili lang na sa buhok sa ulo. Ilahang kilay also, matanggal ang mga buhok din ha, and even ang ilahang mga pilok, matanggal sad na. So that's how strong these cancer drugs are na even the healthy cells will be affected. So let's talk about indications of chemotherapy. They are used when neoplasms are disseminated and are not amenable to surgery. So if you have observed, if a person is diagnosed with cancer, if it is not yet in its advanced stage, the doctor will always recommend surgery. Meaning, ipapatanggal, if ever may solid na tumor, ipapatanggal si solid tumor. But, for example, surgery is not possible, then that's the time we do chemotherapy. But we have different indications. We have the so-called adjuvant chemotherapy, neoadjuvant, and the maintenance chemotherapy. So just like the hypertension and diabetes, we also have maintenance na chemo. Okay? Now, let's talk about first the adjuvant chemotherapy. What do you mean by this? Ginagamit ito siya as treatment to attack micrometastasis following surgery and radiation treatment. So for example, the patient undergoes or underwent surgery tapos or nag-radiation therapy siya to kill the tumor. Pero mag-expect kasi yan ang doctor class na may matitira. So hindi kasi nila yan buong kukunin yung tumor. So there will be parts na matitira. And yung matitira class, para hindi na siya mag-metastasize, micrometastasize, magbibigay tayo ng chemotherapy. Ang tawag dyan, adjuvant. Okay? That's again after surgery and radiation treatment. Also, we also have the so-called neoadjuvant chemotherapy. We give naman this before surgery. Okay? Example, surgery is possible for the patient, but before doing the surgical procedure, we will try to shrink. We will attempt to shrink the cancer or the tumor through the use of chemotherapy drugs. We call it neoadjuvant chemotherapy. And lastly, we have the maintenance chemotherapy wherein we give the drug in lower dose to assist in prolonging a remission. Kasi what's our problem with cancer patients? Example, the doctor declared them cancer-free. However, take note of the word remission, may mga bumabalik na cancer. Most of the time pa nga, pag bumalik ang cancer nila, it's a different type. So for example, they have breast cancer and then they survive the breast cancer. After how many years, they will have another cancer na naman in different organ. So maintenance chemotherapy is given to them as a maintenance na lang, na pero lowered na yung dose niya. Again, to prolong remission. Yan yung mga indications ng ating chemotherapy. Now, let's talk about tumor susceptibility and growth cycle. Our cancer drugs can actually be cell cycle specific or pwede din silang cell cycle non-specific drugs. So that is the reason why 2 weeks ago, I had this asynchronous activity wherein I asked you to review mitosis, what happened sa mitosis class, and sinama ko na lang si meiosis para ma-review din kayo for meiosis. Pero actually, gamit natin yun siya for the for learning the cancer drugs, kasi ito nga yung ating mga types of cancer drugs. Either they are cell cycle specific or cell cycle non-specific. Okay, and then we have the tumor growth rate. Later we'll talk about that. So this one is our cell cycle class, but actually the mitosis is just a part of the cell cycle. However, syempre that one starts with the mitosis. We have there the prophase, metaphase, anaphase, and telophase. And the bigger part there, which is composed of the G1, the S, and the G2 is what we call the interphase. Kasi supposedly, di ba, IPMAT yan siya. Interphase, prophase, metaphase, anaphase, telophase. Pero again, the larger part of the cell cycle is what you call the interphase. The M there is the mitotic phase, wherein the cell is really, meron siya mga activity for the division na. Pero kung sa G1, it's on the first growth phase. So there is growth and normal metabolic roles na ginagawa ng cell. Tapos after that, mag-e-enter siya into S phase, or S means synthesis because this is where DNA replication happens. And then G2 is the second growth phase wherein there is growth, and this will be the time that the cell prepares for mitosis, pag mag-divide na siya. So to really discuss the specific things na nagte-take place in the cycles, so please review the mitosis. Cytokinesis means the division na talaga. The division, including the nuclear division of the cell. Pero sa G1 class, remember that's the first growth phase. What happens there? The cellular contents, though excluding the chromosomes, are duplicated. So everything in the cell are being copied except for the chromosomes for the first growth phase. And then for the S phase, since this is called the synthesis phase, this is where the chromosomes are being replicated. So our DNA are being replicated. They are being copied. And then that will result to daughter na mga DNA strands. And then the G2 phase, or the second growth phase, this is where the cell will now double check the duplicated chromosomes if there are errors, and if needed, magre-repair siya. So it is actually preparing for the division na mangyayari, which actually takes place during mitosis. However, our cancer drugs, if they are cell-specific cell cycle-specific, their mechanism of action is actually here in the cell cycle. So depende na. Basta nakalagay na ang cancer chemotherapy drugs act on the S phase, then it is called cell cycle specific. Kasi nasa cell cycle yung kanyang mechanism of action. Pero kung nag-GO na yan siya, meaning the cell cycle is being arrested, example with the use of the cancer chemotherapy drugs. Okay? Now, let us identify what are these anti-cancer drugs which are called cell cycle specific drugs? Let me give emphasis to this. If we call it cell cycle specific, then their mechanism of action is on the cell cycle. May it be on the mitotic phase or in the interphase, anywhere in the interphase. So what are these drugs? Anti-metabolites, the bleomycin, the vinca alkaloids coming from the vinca roseus, or we call that Catharanthus roseus nowadays. Locally, we call it periwinkle, or sa Bisaya, ay, wala ko kabalo, at chichirika. Kanang colorful nga flower na violet na yellow na pink. Now, we can see anywhere. Muna murag sagbot lang siya. That's the plant na kinuna natin ng vinca alkaloids na ginagamit for cancer chemotherapy. And then we also have the etoposide. Now, where do we use the cell cycle specific drugs? This type of cancer drugs are effective for high growth fraction malignancies such as hematologic cancers, example, leukemia. Okay? High growth fraction meaning madali silang mag-multiply. Okay? Mabilis ang pag-multiply ng cancer cells. Now, we also have cell cycle non-specific drugs. Their mechanism of action is outside the cell cycle. Okay, we have here the alkylating agents. We also have antibiotics. We have antibiotics, anti-cancer drugs. So we call them antibiotics because they are also derived from other microorganisms or other type of cells. The same definition sa antibiotics that we have. Okay? Diba pag sinabing antibiotic, matatawag mo lang siya antibiotic pag galing siya sa other microorganism or other type of cells. And then kaya niyang pumatay ng another microorganism or another type of cell din. So ganun din ang antibiotics class na for chemotherapy. And then we have cisplatin and nitrosoureas. Now when do we use the cell cycle non-specific drugs? They are effective for both low and high growth fractions na malignancies. Pag sinabing low growth fraction, it is yung type of cancer na may solid tumor ka talaga na makikita. Okay? So effective yung mga cell cycle non-specific natin dyan. But they can also be effective for those na mabilis mag-multiply just like the hematologic cancers. Okay? Question so far. Nagkasinabot pa ta sa ato ang mga anti-cancer drugs. I mean, wala pa man dyan kung nag-discuss sa ilahag isa-isa. So this is 119 slides. Kasi actually, isa-isahin natin sila. Lahat sila, anti-metabolites. Under sa anti-metabolites, we have a lot of anti-cancer drugs. So medyo mahaba-haba pa ito. And medyo mahirap lang yung kanilang names. Pero let's try to learn them one by one. Now, let's talk about treatment regimens and scheduling. For cancer, we have this so-called goal of treatment, the 5-log kill. In your biofarm, you have learned the first, what you call that? Zero order and first order kinetics. Again, in your biofarm, di ba, we have the so-called zero order and first order kinetics. Pag zero order, di ba yung dose niya is constant? Ang pagbaba ng dose is constant if you can still remember your biofarm. Kung at 1 hour, on the first hour, nagbaba siya ng 5 milligrams per ml, ganun din yung sa second hour kasi nga constant. But for first order kinetics, dili siya actually constant, and then ang elimination, we're talking about elimination here sa biofarm, dili siya constant. So ang pagbaba ng dose is dependent on the previous dose. That's the first order kinetics. So sa pagdating naman sa cancer chemotherapy, actually this follows the first order kinetics. Pero it's not about the elimination of drugs in the body. It's the elimination or it's the death of the cancer cells. Naka first dose kinetics is first order kinetics siya. Naka 5-log kill siya, meaning walang specific amounts, walang constant na number of cells na namamatay, but nakadepende siya sa dose and naka-percentage siya. That's what you call the log kill phenomenon. So for example, at first hour sa pag-take ng chemotherapy, example 10% ng cancer cells ang namatay, and then on the second hour we have another percentage na namatay, so hindi siya constant. Yan yung ginagawa ng cancer chemotherapy. Okay? Now, we have different treatment protocols. Siyempre, the oncologists are very knowledgeable of this kasi we don't really give the cancer chemotherapy drugs na solo drug lang. Most of the time, they are used in combination. And the combination is dependent on the kind of cancer the patient has. So again, we do combination of our cancer chemotherapy drugs, and these are the reasons. The first one, provide maximal cell killing within the range of tolerated toxicity. So pinagsasabay natin sila so that mas maraming cancer cells yung mai-eliminate natin, but we have to make sure that the dose is still tolerable for the patient, especially when we are talking about the adverse drug effects. And then effective against a broader range of cell lines in the heterogeneous tumor population. So kung i-combine natin, for example, cell cycle specific and non-cell cycle specific, then we can target different types of cells na involved doon sa formation ng cancer. And this may delay or prevent the development of resistant cells. Plus, take note that the cancer cells are just like the bacterial cell or the virus na they can be resistant to the cancer chemotherapy drugs. So atong mga microorganisms, mga bacteria, pwede sila makadevelop og resistance sa mga antibiotics nato, sa mga antibacterial drugs nato. That is why we have the AMR, antimicrobial resistance na drive. Ganon din sa cancer. Yung mga cancer cells natin, if hindi din maayos yung paggamit, yung treatment protocol, hindi nasusunod, the cancer cells will also develop a resistance. And to avoid or to delay or prevent the development of the resistance, the oncologist combine different drugs. Okay? Yan yung mga reasons. So example class of a treatment protocol, naroon silang mga mnemonics na ginagamit para sa mga certain types of cancer. So in the screen, this is the treatment protocol for the non-Hodgkin lymphoma. So again, lymphoma, di ba, is the one that originates in the lymphocyte sa immune system natin and mostly seen in the lymph nodes. So we have two types, Hodgkin and non-Hodgkin. Actually, dili lang sila two types, daghan pagklaseng lymphoma. Pero kung Hodgkin and non-Hodgkin, they have this specific type of cell na hinahanap doon sa tumor. Pag nakita nila, I forgot the name of the cell, pero pag nakita nila yung cell na yon, they call it Hodgkin lymphoma. Pero pag wala, it's called non-Hodgkin lymphoma. So how do we treat that? We have here the R-CHOP as the mnemonics for the treatment. So we have R means rituximab, C is cyclophosphamide, H is hydroxydaunorubicin, and then O is oncovin, or pwede din siya vincristine. I mean, oncovin is the brand name of the vincristine. That's the name of the anti-cancer drugs. And they also include prednisone in the treatment. Because prednisone is an immunosuppressant, it's a corticosteroid, and remember that lymphoma is on the immune system na part. So para makahelp siya with the 4 na anti-cancer drugs na na-include dyan, dinadagdag si prednisone. But how do they give this combination drug for non-Hodgkin lymphoma? This is scheduled intermittently, usually 21 days apart. Hindi naman siya pinagsasabay-sabay. Mamatay atong patient, ani daghan kayong klaseng drugs na gibutang sa iyahang lawas. You remember, they are strong drugs, so they don't give them at once. May intermittent tayo. So for example, they start with the rituximab. After giving the rituximab, after 21 days, cyclophosphamide na naman, and so on. So yan yung tinatawag natin na treatment protocols for cancer. Okay, questions? Wala? Sige. So let's talk about problems associated with chemotherapy. I have mentioned this a while ago. We have the problem about resistance, especially the melanoma, because that is yung grabe ang incidence of resistance ni melanoma. So to avoid resistance, the treatment should be short-term dapat, pero intensive. And at the same time, if we are giving combination drugs, it has to be given intermittently, hindi sabay-sabay. So sa resistance, hindi lang yan siya specific for one drug. Multi-drug resistance can also happen. So just like our microorganisms, the bacteria, the virus, merong mga cross-resistance among the drugs, ganun din yung sa cancer. So the reason for that is the presence of the P-glycoprotein. Ito si P-glycoprotein, notorious talaga ito in causing multi-drug resistance. It's actually a small protein inside the cell, pero kontrabida kayo na siya, kanang nakasulod na ang drug sa cell, ang iyang trabaho is, 'di ba kailangan makasulod sa cell no ang drug kay na dito mostly ang mga receptors. Ang trabaho ni P-glycoprotein, palayaso niya ang drug, meaning ipagawas niya sa cell imbis na nakasulod na. And that is the reason why naatay mga multi-drug resistance. And syempre, toxicity, hindi yan siya nawawala. Plus, especially that chemotherapy are considered very strong drugs that can affect a lot of parts sa atuang body. Okay? And then, aside from that, kung naririnig nyo ito, class, na pag nagpa-chemo, minsan nadadagdagan yung cancer, minsan nagpo-cause siya ng another cancer, kasi talagang naapektuhan yung other healthy cells. So, meron din tayong problem with treatment-induced tumors. So, especially with the use of our alkylating agent. So, that is the reason why if you work in a hospital, kasi sa community we don't really see the cancer chemotherapy drugs. Sa hospital marami nito. Nakaseparate talaga class yung storage area for our cancer chemotherapy drugs. We don't open the storage area kung wala tayong kukunin doon, wala tayong gagawin doon. And we don't open the containers, the immediate containers, the box, the vial or whatever. We don't open them sa pharmacy also. The nurse will open them sa bedside na kung i-administer na siya sa patient. Kasi once you open that, you will be exposed to the chemotherapy drug. And remember, kahit wala kang sakit, since you are exposed, there are chemotherapy drugs that can cause tumors also. So be careful with that when you work in a hospital setting where you can see a lot of chemotherapy drugs. Okay? Questions so far? Natulog na mo diha? Kasi natulog na mo ha? Buhi pa mo? Buhi pa. Okay, sige, buhi pa sila. Nag-buffer na inyong brain. Nag-buffer sa'yo pa man sa buntag, nag-buffer na. Okay, now let's talk about the common adverse effects. These are just common, pero may mga specific adverse effects itong mga specific anti-cancer drugs natin. Commonly, after giving the chemotherapy, there will be severe vomiting. I don't know if you know someone with cancer, after chemo class, magsigig yun na silang suka. Okay, severe vomiting. That is the reason why we give antiemetics also to the patient. Example of our antiemetics, metoclopramide, brand name of that, well-known na brand name of metoclopramide in the market is Plasil. We are done with the discussion about that kung nag-discuss tag serotonin. And then aside from that, we have the cetrons, granisetron, ondansetron, that will also act on serotonin receptors, and those drugs are considered antiemetic that can be given to cancer patients. Okay? Yeah, nag-PPE sila, Mika. Nag-PPE sila kasi they will be exposed once they will open the chemotherapy drug, may expose sila. So they have to protect themselves also. So in the pharmacy, actually that is the work of the pharmacist, pero since we are not present in the bedside, it has become the work of the nurses to administer, and even the doctors to administer the chemotherapy drugs to the patient, and sila yung na-expose. Pero alam nila that they have to protect themselves. So kita sa pharmacy, let us not expose ourselves also. Ayun yung abrihin ng mga containers sa cancer chemotherapy drugs, since you will know their names now. Ayun ninyo na sila gulay, or ayun ninyo basta-basta abrihan ilahang mga container. Yeah, mulagong dyan na mag-iba ilahang color. Yeah, tama na siya. Pero again ha, most of our anti-emetic drugs act on serotonin receptor. So different receptors though. Metoclopramide is a serotonin agonist, while the, or baliktad, agonist, yeah. And then the cetrons are antagonists. Pero lahi na sila nga type of serotonin receptor. And then we have stomatitis. What do you mean by stomatitis? Anyone? So meaning sa stomatitis. Itis means inflammation. Inflammation sa unsa?
Sa mouth, ma'am.
Okay, very good. Sa mouth ha, if there is an inflammation sa mouth, anywhere sa mouth, the gums, sa kaning tawag anak, mga buccal cavities nato, anywhere there, basta na inflammation, we call it stomatitis. Even kanang luas is considered as stomatitis pag nag-inflame na siya. So, mapod na ang pirmi ma-experience sa ato ang mga patients undergoing chemotherapy. And then there will be bone marrow suppression. That's the effect of the chemotherapy drugs. So, if bone marrow is suppressed, then there will be decrease in the level of their blood cells. For example, their red blood cells will be decreased, and some of them develops anemia. And then, ito na yung tanong kanina, alopecia. This is very common sa lahat ng mga anti-cancer drugs natin. Natatanggal ang buhok, not just sa head, but anywhere in the body. Maski sa tiil, di ba natin mga balahibo sa tiil, pati ka na matanggal if the patient is undergoing chemotherapy. Now, we have here specific na adverse effects, and then specific drugs sila ha. Kasi gisalin ako niya siya dire kay common board exam question ito. So example, we have cyclophosphamide. That's the name of the chemotherapy drug. Notorious siya to cause bladder toxicity. So it will really affect the urinary bladder of the patient. And then we have the doxorubicin. That's another name of an anti-cancer drug. Ito naman is well known of causing the cardiotoxicity. It can affect the heart, it can damage the heart. And lastly, we have the bleomycin, which targets the lungs. So pwede magkaroon ng pulmonary fibrosis ang patient natin. Okay? Questions before tayo, anong time na? 9:55. Before dyan tayo mag-go deeper, kasi starting here, magsa-start na tayo ng discuss na one by one ng lahat ng mga anti-cancer drugs natin, and medyo complicated ito. Kasi we will go back to your biochemistry for this. DNA and the RNA synthesis and so on. Any question? Wala. By the way, segue pang mo. Talk about the anti-metabolites class. Ang tawag sa ilaha, anti-metabolites. Let's talk about their structure. Their structure is almost, or they are derived from the normal compounds which are actually seen in our body, especially those compounds involved in the DNA and RNA synthesis. So yan yung tandaan ninyo. Anti-metabolites structures are derived from the substances found in the body. Brown out. Wait lang, class.